Alright, we have a pretty straightforward endocrinology question today. Let me know in the comments how you guys found this question and if we should make them easier or harder. So we have a 24-year-old man presents with sudden onset palpitations, sweating, and severe headache. His blood pressure is 190 over 120. Plasma metanephrines are elevated. Which of the following should be first given to control his blood pressure before surgery? So we have some hints in the vignette here. We have the palpitations, the sweating, the headache, and the very, very elevated blood pressure. However, your biggest hint is going to be the plasma metanephrines being elevated. This is basically implying that this is a pheochromocytoma, which is a tumor of the adrenal medulla. What this tumor does is it releases a lot of catecholamines like norepinephrine and epinephrine. These bind to alpha receptors and create very high sympathetic activity going on with the body. So you're going to have a very high pulse. Your heart rate's going to be elevated. Your blood pressure is going to be elevated. You're going to sweat. You're going to have tremors. It's that type of tumor. And we diagnose pheochromocytomas by assessing if there's plasma metanephrines like in this question, or also we can do a 24-hour urine collection to see if there's any metanephrines in the urine. So let's start with A, propranolol. This is a beta blocker. You could give this, but not initially. You have to give a drug before you give a beta blocker, because if you give a beta blocker in this situation, what you're going to do is cause unopposed alpha activation. So you're going to make the sympathetic activity even worse. The blood pressure is going to get higher, tachycardia all over the place. So you don't want to give a beta blocker initially, but hold on to that thought for a second. So now that we've established A is wrong, let's move on to B, lisinopril. Lisinopril is an ACE inhibitor. It inhibits angiotensin converting enzyme. So it blocks the conversion from angiotensin 1 to angiotensin 2. It does lower blood pressure. However, you use it in different scenarios. When you have kidney issues or chronic kidney disease, you use it when your RAS or your renin angiotensin aldosterone system is elevated, and it has retention of water and sodium. So we use it in that situation. It wouldn't do anything for a pheochromocytoma. Therefore, B is not the best answer here, and that's wrong. C, phenoxybenzamine. This is the correct answer. So what phenoxybenzamine does is it blocks alpha-1 and alpha-2 receptors irreversibly, and this is what we want in pheochromocytoma. All your catecholamines like norepinephrine and epinephrine, they're binding to your alpha receptors. So if you use phenoxybenzamine, you block off those receptors. Epinephrine and norepinephrine won't be able to bind to those receptors and won't be able to increase sympathetic activity. Therefore, all your problems are basically gone. And this is where you can use a beta blocker. So you use beta blockers after you've used alpha blockers. If you use beta blockers first, you won't be able to, you'll get alpha unopposed activation, and it'll just get 10 times worse. So you got to give phenoxybenzamine, then you can give propranolol after. And as for D, amlodipine, this is a calcium channel blocker. This does lower blood pressure. However, it's insignificant with a pheochromocytoma. You're talking about a bunch of catecholamines going all over the place and activating your sympathetic nervous system. Amlodipine isn't sufficient enough or alone to lower the blood pressure in this situation. Therefore, it's not the most appropriate answer, and it won't do much against the pheochromocytoma. So it's also wrong. Last but not least, we have furosemide. This is a loop diuretic, usually used in heart failure to get rid of excess fluids in the body. Furosemide lowers the blood pressure as well. However, as I said before with amlodipine, it's not sufficient enough, and it won't do anything against the pheochromocytoma because that's not the cause of your problem. You want to attack the cause, which is the catecholamine surge, and furosemide doesn't really counteract that. Therefore, E is incorrect. Thanks for watching this video. If you guys like this video, please follow our page. Also follow our TikTok and YouTube. Thank you for your support.